A new analysis by researchers at Harvard University shows that the bed capacity of hospitals in many parts of the U.S. will be overwhelmed if the COVID-19 coronavirus continues to spread across the country. And as Amna Nawaz reports, hospitals and healthcare systems are working to increase their readiness.
Judy, the Harvard study indicates that when spread over a 12-month period, even a moderate number of coronavirus cases will begin to fill some American hospitals to capacity unless they free up already occupied beds. The faster the pace of infection and the larger the numbers grow, the greater the shortfalls become. For what hospitals are doing to prepare themselves and what more needs to be done, I'm joined by two people who focus closely on preparedness. Jeremy Konyndyk is a senior policy fellow at the Center for Global Development, whose research focuses on global outbreak preparedness, among other things. He joins us by Skype. And here in the studio, Dr. Bruce Siegel. He's the president and CEO of America's Essential Hospitals. That's an association of more than 300 hospitals and healthcare systems. And welcome to you both. Dr. Siegel, I want to start with you here. We know there will be a surge of patients. We know that's coming. You told my colleague earlier, our hospitals are moving quickly to prepare for that. What specifically are they doing right now, and are you confident they'll be ready?
So the good news is that millions of health professionals in our hospitals are working hard to prepare. They are clearing out some of the elective surgery cases, things that don't have to be done right now, to get that space ready for a surge in patients. They are expanding their capacity, bringing beds and floors back into use that were maybe not used, building tents for triage centers and testing in their parking lots to keep sick patients away from the rest of their patient population. There's a lot going on.
How confident are you they're going to be ready to meet with the expected surge?
I think that they will do a good job of meeting that surge. I think if we as citizens also try to make sure that surge is as small as possible by distancing ourselves from each other as we're doing right now, that'll help a huge amount. My concern will be, will they have the resources for a sustained response? And that's going to be something that Congress is going to have to really think hard about and act on in the days ahead.
Jeremy Konyndyk, let me ask you about this. Some people will look at the maps on this, and it's very alarming when you see how much of the country and how many of our hospitals could become overwhelmed. Those darker red portions, by the way, represent over 1,000% capacity for some of those hospitals, and that's in a moderate scenario. Tell me how you're looking at this. Do you believe the healthcare system and the hospitals can get to the capacity they need to handle even a moderate surge?
I think it's going to be an enormous struggle, and it's complicated by the fact that we've already lost quite a bit of time. We should have begun the process of this as soon as we saw what was happening in Wuhan, China in mid-January, the way that hospitals and modern hospitals there were overwhelmed very rapidly by this virus. We're going to face struggles with PPE. We're going to face struggles with healthcare workers becoming infected. We have lost a lot of time. I think there are measures that we can begin to take. Some of the things that the president announced today are positive. It would have been better if they'd been announced a month ago. So we're kind of in catch-up mode still.
What did you hear today that was positive?
Well, I think the Defense Production Act, I think the moving of the hospital ships, all of those things help somewhat to relieve the pressure, but they're also, it's going to take a while. I mean, we learned after the announcement that one of the hospital ships won't be ready to leave port for a few more weeks. Obviously, Defense Production Act work, if you start telling a company now to start manufacturing ventilators or N95 masks, that's not going to show up in the supply chain for weeks or months.
Dr. Siegel, the PPE that Jeremy mentioned, that is personal protective equipment, that is what your frontline healthcare workers need.
Absolutely.
To be able to protect themselves
Yes.
when they're handling those patients. Are you close to having what you need, and how dependent are you on the federal government to get that supply?
So we are not close to having what we need. We're already seeing some spot shortages in some areas, and that could get worse, a lot worse, as the surge materializes. We are very dependent on the federal government for making this happen. And I'm glad that there are, things happening now to start to get manufacturing up, and to start to divert resources to this sector. But, my biggest concern is that we have, stressed safety net hospitals in this country, stressed rural hospitals with maybe a week of cash on hand. As they lose their paying business, as they see a spike in uninsured patients coming in, as they have to, spend millions and millions on treating sick coronavirus patients, they're going to run out of resources. They will literally could run out of money, and we're going to need Congress to make sure that we have that backstop to be there for these communities, given how sobering it's going to be.
The other thing people hear a lot about are ventilators and the need for critical care in severe cases. Do you have the ventilators you need? Are you confident you'll get the supply that you need?
We are working as hard as we can to make it happen. We need the government to step in. Are we sure we'll have what we need? No, we're not. Let's be very clear about that. And I'm glad that we're preparing and moving all the things we need to in place, like the hospital ship, so that's going to take longer than we expected. But we still have a long ways to go. And the decisions we make in the next few days around resources, around this stimulus bill, are going to be absolutely critical so we can really do this for the long haul, because this may go on longer than some of us would ever like.
Jeremy, you mentioned that Defense Production Act the president put into place today. To what degree do you think that will fill this gap Dr. Siegel is saying that we know we have right now? And what other levers of the federal government could we be pulling and using right now if needed?
Yeah, I think the Defense Production Act it basically forces companies to manufacture certain things. I think the companies would probably be inclined to manufacture those things anyway if it keeps their factories running and if there's money behind it. So I think it's a helpful tool. It probably isn't a total game changer. One of the things I'm still hearing about from a lot of the doctors I talk to in New York City and in Northern California is lack of testing. They are still struggling to get the testing that they need, both for their patients but also for themselves. If they are exposed, it's quite important they be able to get a test quickly to determine whether they're infected or not, because if they're infected, they have to go into quarantine. If they're not, they can stay at work. Right now, if you can't tell, you have to take the precaution and you lose them from the workforce.
But Jeremy, when you see the president speaking now, you see a number of different officials from different agencies working together and working behind him. Are you confident that every single element, every single resource at the government's disposal is being used right now, or are there other steps they could be taking right now?
I'm not confident, and I think I think they have made some headway, but they're still not where they need to be. We were in a sort of inactive mode for about the first month and a half of this, where we were really not moving out in an expeditious way on preparing the homeland for the arrival of this virus. I think we've now moved into reactive mode, but we're still not in proactive mode. So yes, they're starting to get some things in motion, but they're still playing catch up. And I think it's hard to have confidence in the overall management of this, given what we've seen so far, but I hope it will improve.
Dr. Siegel, when we see some of the projections, obviously, as Jeremy said, there's a lot we don't know. We don't know how long it will take. We don't know when the surges will happen, when those viruses will peak. How do hospitals prepare for this? Do they go for the worst case scenario, or do they hope for a mild outbreak?
Oh, you have to think about the worst case scenario. So our hospitals are really thinking about how bad could this get? Realizing that it may get bad in one community now, and maybe it'll get worse in another community, some weeks later. But they have to be prepared for the worst, or at least do their best to get to that point. We can't be, optimistic, or hope is not a policy here. We've got to really, and I'm confident they are, our hospital leaders and nurses and doctors prepare for, how bad this could be, even though we hope to avoid it by doing the things we're trying to do right now.
We all hope those plans will come together. Dr. Bruce Siegel and Jeremy Konyndyk, thank you very much for your time.
Thank you.
Pleasure.
And please join us tomorrow when we are hosting a virtual town hall confronting coronavirus at 8 p.m. Eastern, 7 Central on all PBS stations and streaming on the PBS app and on the PBS NewsHour social channels, including YouTube, Facebook, and Twitter. Please watch to hear some of your questions answered by people who are on the front lines of the crisis.